Welcome back to Jess Saying. Today we're diving into a topic every parent needs to hear, which is how to speak up and get better health care for you and your kids. Let's be honest, walking into a doctor's office with a sick child can feel overwhelming. But what if you had the tools to walk in confident, prepared, and ready to advocate like a pro? Joining me today is Dana Sherwin, healthcare consultant, former executive, and a mom who's been on both sides of the exam table. She's here to share what every parent should know before a doctor's visit, how to spot red flags, and why your voice matters more than you think. So if you've ever left an appointment feeling unsure, unheard, or just plain frustrated, this one's for you. Let's learn how to speak up and get the care our kids deserve. Hey friends, we're here today with Dana Sherwin, the CEO and founder of The Thinking Patient, and we're going to rack her brain about a very important issue about advocating for yourself as a patient in the healthcare industry, and also for your children, which is very important. Dana, how are you doing today?
Great, thank you, Jess. So great to be here.
So can you tell me a little bit about your background in the healthcare industry? I actually went on LinkedIn, and I had to actually scroll down because you have a lot of healthcare industry background, and then also tell me a little bit about The Thinking Patient.
Okay, great. Well, I have sort of an interesting story that I was introduced to the healthcare industry at a very early age because my father was worked his way up in the health insurance industry, and actually just at one place. It was a not-for-profit insurer, and he loved his job, and he really encouraged me to take a look at the healthcare field. So really, when I was 16 and thinking about what I wanted to do the rest of my life, which is so crazy even thinking about knowing what you want to do at 16,
Right.
I said, I know I'm not really geared to be a doctor or a nurse or a psychologist, but I think healthcare is so important, and I want to be in the field. So maybe healthcare administration is a really good path for me. And I pursued it, and I went to undergraduate, and then I went to graduate school, which is one of the best schools in the country for healthcare administration. It's the University of Michigan School of Public Health. And I got my master's degree there, and really from there, came back to New York. I'm originally from New York, and I wanted to, be in the community I grew up in. And also in New York is such a diverse population of both, community and also of a hospital system and healthcare. And I thought, like, if I could make it here, I could make it anywhere. It was sort of that kind of feeling. I mean, I just was very drawn to opportunities in New York. So I came back and had a very diverse career in healthcare administration. I did consulting, I did policy making, I did some hospital administration, and then I moved into the managed care field. So I had a really very varied career in healthcare. And then I was working until my health crashed. And my health crashed. I had an underlying genetic disorder. And in 2019, I had to sort of stop my work and take care of my health because the kind of disease that I had required a stem cell transplant. There was no other cure. So I was too sick to be able to work. And I really had to spend very close to maybe 9 months planning for the stem cell transplant. And it was, I wasn't feeling well. I had other things going on in my family, the sort of the sudden leaving of work. And I just actually celebrated my 6th anniversary of my stem cell transplant. So I'm so happy to say that and feel really good about it. And it really shifted my view of my life and what I'm doing every day, and feeling good and really looking at all the positive things in my life, because there have been huge positive things in my life. But when I started feeling better a few years ago, I thought, well, I can't go back to work full time. What can I do to bring what I learned as a hospital executive along with what I learned as a patient through my very complex patient journey, bringing those things together And that's where I really created the Thinking Patient as a small consulting company to bring tools and resources to people to help them not only communicate with doctors, but be more engaged in their care. And I really felt that this was an area I think I had an important contribution to make.
So you're helping physicians and organizations and their employees like better like learn how to communicate with their patients, right? Is that
Well, I would love to go in on the physician, on the clinical side, but that's not my community. So I talk to all of my doctors, and I talk to anybody who will engage in this conversation because I think that what I can do best is try to influence organizations and communities of patients in terms of what patients can do to be more engaged in their care and take better control and work in partnership with doctors. So look, I don't work in a medical school. I don't work in the medical field. I can't change the structure and the standards available for the practice of medicine. But what I can change through my experience, what I can send out as messages and resources, how people, and I think we're all patients. We're all
right?
patients at
I was
certain
just gonna
times
say,
in
I was
our
gonna
life.
say, I think the world is a patient. You got the world as your oyster because everybody's a patient, and they have their children and they are patients too. And so one of the things I wanted to make sure that we address is the importance of advocating for your children's needs as well and speaking up. I just in my own experiences, I like my husband also. He, like, we discussed this before in our meeting where my husband, he will not go to the doctor like at all ever for anything. And he works in a hospital. Okay. He takes people out of bed and he walks them down the hallway as a physical therapist as they get out of surgery. He is in the hospital every day, but he's not a good patient at all. So if he's not going to, speak up, then I have to, step in and go, pull him by his ear and say, we're going. And then I have to make sure that I'm asking all the right questions because he won't. And same thing for my kids too, because my kids have all three of my kids actually, they all have something. And my daughter, we just found out she had a genetic disorder and we didn't know because technology has changed. So must our questions that we ask, back when she was born 15 years ago, we had her tested and she came out clean as a bell, which is great. And then we just had her tested a few months back and she came up with, she has 16p, which is a duplication of chromosomes. And so, now we have a whole new door of things that we're going to have, and geneticists and new doctors and different things that we're doing. So I think it's important that maybe you can help us with some tips to help us and guide us, maybe prepare for doctor visits, knowing what to ask, recognizing when something's not right and like speaking up about it and building up the confidence to speak up. And I don't know. I'm happy that you're here because I know there's probably a lot more things that I don't know. I mean, I'm starting to learn a little bit more now that, now that I have a daughter that needs me more as her voice. But I know there's things that I probably can learn here today, which is why I'm glad you're here today. I'm excited that we can dive into this topic.
Oh, absolutely. I think one of the points that you hit on is so important, that being engaged in your care is also sort of expressing what you don't know. So you can decipher what you know from what you don't know. And you won't know what you don't know until you have those conversations.
Right.
So what I start with, whether it's advocating and being able to represent yourself or a child, it is the same thing. Some of us were lucky, had parents that maybe were good role models in terms of when you went to a doctor's appointment with your parent and you heard your parent ask questions, you heard your parent be curious, all these sort of the knowledge and skills. But most of us were not brought up that way. Why?
Right.
It's not something they teach in schools. They don't teach it in college. Employers don't spend any time teaching their employees how to best use and access the healthcare system. Insurance companies don't really share that information directly. It is so much, on the web, in the internet. There's so much information out there, but it's so overwhelming. And when you're in a healthcare crisis, you don't have time to spend 2-3 hours doing that research, on an initial basis to
Right.
set up like a framework for how you're going to approach this. But most people do have um, either anxiety or fear or bad past experiences. There's something that's blocking them. I mean, maybe your husband working in the healthcare system, what's blocking him? Because I had that. I did so many things wrong, and I spent 35 years in the healthcare system with the access to the best hospitals and the best doctor. And I ignored my symptoms, not until there was nothing they could do about it, which I found out later. But I ignored so many things, which is why I come sort of more with an organized system now, because I realized what I did wrong, what I could have done better. And then through my research, I came up with really a structure and a pathway for people. So if we're really going to start to, how can I best help myself or my child? The first is preparation. You need to prepare before a doctor's appointment and not just sitting in the waiting area. Most people have told me it's so hard to get an appointment with a primary care physician or a specialist that sometimes you're waiting weeks, if not months, to get an appointment. Well, during that time, you should be sort of take notes on what you're thinking about, what's bothering you, what you want to learn more about, what kinds of questions you should be asking. You meeting a new doctor for the first time. Let's say you're meeting a gastroenterologist. Well, if you're meeting somebody for the first time, you can even Google or use AI to say, I'm meeting a gastroenterologist for the first time. I have XYZ symptoms. What are the questions I should be asking the doctor? So in preparation, what's important is to, obviously, you want to share with the doctor who you are, bring your medical information, what's most important to you, what your priorities are, what your questions are, and any sort of information that came from other doctors that you want to explore with this doctor. What can we talk about? And when you have this in a written form and your agenda, then you'll be ready to enter the exam room and the visit with the doctor, not just prepared, but prepared. You don't have to forget. You won't forget the things that you were thinking about that you want to make sure you cover, that you could actually engage with the doctor face to face, because you have what you want to cover right there. You don't have to worry about forgetting it. It's like all there. And when doctors see that you come in prepared in that way, in a thoughtful way, not just throwing information at a doctor, but saying,
Right.
look, this is who I am. I want to share who I am. I want to learn more about how I can help myself and what available treatments there may be. I don't understand this. Can you suggest other resources? So that preparation really gives you this prepared framework. Visits are short these days. If you're lucky, you got 15 minutes, 20 minutes. It's a
Right.
pressurized, compressed time to have such an important meeting. And, even though most people are covered by some type of insurance, still the visit is an expensive proposition. And the physician feels the pressure of these limited appointment times as well, and trying to get to know patients and trying to do the right thing. So that's why I say preparation is like the first step.
Preparation.
Preparation.
Can I ask you something? Okay, so I want to interject just a little bit. Okay, so let me just tell you a little bit about my little story. Okay, so I'm getting up there in age, where I'm starting to become, I believe, that part where my hormones aren't the greatest. I mean, I'm not trying to get too personal, but I haven't had my period since 2015, and I'm trying to say I think I'm in menopause, and he's saying no, the blood tests don't provide that you are. And I'm like, but I am. I think I am. I can't lose weight. I'm hot all the time. I mean, I get out of the shower and I'm like sweating. It's like, this is just ridiculous, And my poor husband has to sleep with like a parka because I like turn up the AC so much. And in fact, we're going out of town. I'm like, make sure you bring a sweatshirt because I'll have the AC in the hotel room. And so, but my doctor keeps telling me no. And I'm like, I've been with this doctor for 20 years and he knows everything about me, and because I did have a cancer scare with my thyroid, which is a whole nother story. But I don't have a thyroid, so I have to take levothyroxine, which is like for thyroid. And so I get my blood checked every 3 months or so, and for him to give me my medicine. And I'm just like, he's not listening to me. And I don't, and I'm almost wanting to like go to see another doctor because I don't know, maybe I'm wrong, but I guess I feel like I'm right. Everybody always feels like they're right, but something's not right and he's not listening to me. And I don't know how to speak up, I guess, or build the confidence to say, I don't care, just put me on the medication anyway. I don't know what to say, but I feel like, why can't I lose weight? I did try those drugs that you buy, those weight loss drugs, not Ozempic, but the Wegovy or something. And it worked for a little while and then it stopped working. So I stopped taking it, but my insurance doesn't cover it. So I had to pay out of pocket. And, but I wasn't seeing the online doctor for that. But I feel as though this is a hormonal thing and I'm not speaking up, or I don't know how to convey my concerns in a way that he'll listen. Do you know what I mean?
In a case like that, when this is a primary care doctor, right? An internal
Yeah.
medicine doctor,
Yeah.
right? So in a case like that, where something is very specialized, and again, I don't give medical advice.
Right.
Everything is just informational.
Right.
I would suggest, no matter what you're using the menopausal symptoms as an example, I would say go seek out a doctor who specializes in that. There are doctors who specialize it, whether it's
Okay.
gynecologist or an endocrinologist. I think endocrinology. So you find the other specialist and make an appointment and use this to speak to another specialist, because sometimes if you've been seeing somebody a very long time and it's a good relationship, you don't want to damage that relationship, but it's really up to you. You want to get more information, you want to validate, you want to see what else you can do. You shouldn't feel feel held back by any loyalty to a particular doctor, because it's really about you taking charge of your health and seeking out the answers that you need.
I mean, that's like, I don't know why I didn't even think about that. It's so funny. You talk about like we grew up, like my mom, she always took us to the doctor when we needed to, but she had 4 kids. So she had to make sure that we were really sick, she had to make sure, because, she'd take those, Bayer aspirins and she'd, when we were little, she'd put them in water and put it on a spoon. And that's what we had. We didn't have this liquid Tylenol and all that stuff, or that we had the St. Joseph's children aspirin. And when those weren't working, then she took us to the doctor. But we didn't really have, we went to the doctor if we had to. But what I'm saying is we had the same doctor for my whole life. I think he delivered some of us. I'm not sure. His name was Dr. Toller, but even in my book, I talk about it. Oh, we went to Dr. Toller all the time. I talk about Dr. Toller, and it's kind of funny, but I've had the same doctor for 20 years. And I guess I just never thought, and an endocrinologist is what you said, right? Okay. So ladies, if you're out there and you feel like you're going through the change and your doctor won't do anything about it, go see an endocrinologist. That's what I'm going to do. I'll have to give you guys an update and tell you if he puts me on something, because I just feel as though something's just not right. I'm not moody or nothing. I don't know if that's a symptom, but I'm not moody. I don't know if maybe I'm not completely there, but I mean, I'm at the age where it's going to start to happen any day,
Well, it's
so.
just an example of where, you know, to live really a quality life and a good life and to reduce the risk of health conditions, taking care of your health up front is so important. And then I keep going back to, it's not something anyone really teaches you. You learn either by trial and error, or there are people who are really into, physical exercise and eating well, and they have all those components, but they don't like going to see doctors. So they don't get that annual checkup. They don't know you can have high cholesterol, whether you're in
That's
the
my husband.
shape possible. You can have high cholesterol. You can have other things wrong with you. It's really important to be connected with a primary care doctor and to have some baseline tests of where you stand, metabolically, physically, whether you're feeling something or not. Also, genetic testing, it has been so advanced over the years,
Yeah.
back when we were young, they really wasn't much. There were the BRCA tests for breast cancer and maybe a few other tests for my disease. which was diagnosed in 2003. It wasn't until 2005 that they came out with a genetic test to validate that that was the disease that everybody had. So I mean, I knew I had it, and the doctors confirmed that I had this. I had a blood cancer disorder. It was a genetic disorder. So, let's go back to
Yeah, I'm
what
sorry.
else.
I got you
No,
out of
no,
I got you
all
out
good,
of turn.
all good, all good.
So
So, but
first,
let's
so
go.
first we so first we first you said we need to be prepared for our first visit when we see him, and
Right.
then I took you off topic. I digressed to another
Yeah,
direction.
no,
I'm so
that's
sorry.
it's all related. So when I
Sorry.
really present like my 5 steps, they're all, I present it usually in a pie shape form, and all the ends of the pie connect because everything is really connected, and every little bit of information you learn or good experience keeps building and building. And, I'll talk about that in a minute, but the second part is really, um, the language of you, the language of your disease, the language of your medications, the language so you're able to ask questions, the language so you're able to understand research you may do on your own. So many people I know can't even pronounce their diagnosis. Well, I bet they could pronounce it if they spend 5 minutes trying to like really look at it and understand it. Same with medications. Every time you have a doctor's visit, it's protocol that they review all your medications. Well, I take 15 medications, and as they go down the list, if I said, "Oh, what's that one again for? What's that one used for?" I'm going to use up 8 minutes of the 15 minutes that I have with the doctor.
I
So
keep
I
a
want
list
to
in
make,
my wallet. I keep
I
it
want
written down in my wallet
to,
because if anything should ever happen to me, I'd want them to know this is all the stuff, you know?
yes,
Right.
yes.
Definitely.
So it's really language. It's really getting comfortable to the best of your ability. It's about healthcare literacy, but it's really about to the best of your ability, because as you get engaged and as you learn more, you'll just get better and better at it. So that's like a second part. The third part is question asking questions, preparing to ask questions, being able to ask questions during the appointment, and then in a way recording answers to questions because it may raise more questions. And as I mentioned previously, when you ask a question, even if you think you know the answer, but 99% you think you know the answer, you ask it anyway. I have so many times just like, oh, I just want to confirm that I understand this, and I was wrong, and the doctor clarified it for me. So it's just as important for you to understand what you know from what you don't know. It's very important. Also, there's so much information on the internet and on trusted websites that give you set questions that you can ask per specialty. What should I know? What are the risks of the treatment? What are the benefits of the treatment? Will this benefit me? What are the potential harms? What kind of experience have you had, doctor, with this particular disease or with this medication or with this treatment? Have that facility to ask questions. And again, the more you ask questions, and I'm talking about in this case, because of the shortness of the doctor's appointment, I'm not saying there are bad questions, but as you get better at doing this, you really want to get to the heart of the matter. You want to get to the heart of like what you need to know and be specific about what you need to know. Doctor, if you were in my shoes, what would be the things that I need to know about taking care of myself with this illness? What should I be looking out for? What foods are contraindicated with the medications? If it's something very complex, are there clinical trials available that I can be part of because the treatments are limited. And I actually participated in a number of clinical trials because there was no cure for my disease, but for a stem cell transplant, none of them worked. But I felt like I was involved. I was doing something, and I wanted to do anything I could to be part to maybe. I was always very hopeful every time I entered a clinical trial. This is going to work for me. But for some reason, I wasn't that disappointed when it didn't work. It was like, okay, what's next? Let's try
Don't
something.
they have like a placebo? Some will get it and some won't, or is
Not
that
all
more?
trials. Not all
Okay.
trials. Some
Okay.
trials, everybody gets the drug. Everybody
Okay.
gets the thing. And then other trials. But you will know from the protocol of the clinical trial, what it is. And it's really up to you to evaluate. And you could always ask the doctor, look, what are the trusted websites I could learn more about my disease? Right. Or when I was needed to figure out which big academic medical center that I should go to for my transplant, there's a whole country full of really excellent hospitals, and I did my own research, but eventually I decided that I wanted to be where my doctors were, and it seemed good enough to me, and there were so many benefits of me being close to home, so my family could visit, so I'd have a support system, and that I really thought my doctors were really terrific. But it ends up all being a crapshoot. You do the best, you make the best decisions that you can make with the best information, but you have to participate. You can't say, doctor, just tell me what I should do. I mean, I don't know, that would drive me crazy, because the doctor needs to understand you. You need to understand the doctor. It's really a true partnership.
You
So,
know,
yeah.
I do agree. I totally agree with you. I also think that if you can join which my parents never, had the option, but to join groups. My daughter has tetralogy of Fallot is another thing. She has a heart issue. So, but there's groups out there, and other people have or might be experiencing something that you might not even know is a part of this disease or problem, and you might not have asked those questions to your doctor or got the right, so if you hear other people's stories and they're going through something that, wow, am I going to be doing that? Is that going to be happening to me? Those are some questions that you can actually bring up to your doctor too. And then I have one story real quick, not to throw you off again. So we're put a point back into where we're at. But okay, so my daughter, when she was born, she spent 5 days in the NIC unit, and the doctor was doing his rounds because he was going to release her that day, and we're excited. And he comes over and he goes, "Nurse, did you hear that heart murmur?" And the nurse is like, duh, because all the nurses, they pay attention, they've been, loving on her for all week. And she goes, "Yeah, it's noted in the chart." And he goes, "Oh, I have to send her away for an echo." And so he comes back the next day and he says, "Okay, I need to sit you down." And he was very serious. Me and my husband, I had to wait for my husband to get off work so that he could talk to us both. And he sits us down and he says, first thing he says is, "You're going to want to look this up." He goes, "But don't." Like, what? And so my mom, who I told my mom, "Okay, Mom, I'll call you right away when he tells me." No more did he say those words come out of his mouth that I started dialing my mom's phone number. And he goes, and I held the phone like this, and he goes, "Your daughter has tetralogy of Fallot. You're going to want to look this up, but don't." And I go, "Mom, it's called tetralogy of Fallot." And I go, "Can you spell it?" And I'm like, "Mom, it's T." And I'm telling her how to spell it. She goes, "Oh, Jessica, oh my gosh." And so I go, "Mom, I'll call you back." That's all I needed to know, because he was making it seem like this isn't a serious thing, but my daughter needed open heart surgery. They had to crack her chest at 5 months. I mean, it was very serious. So, I mean, I guess, and you got to be, you've got to be aware, you have to, don't let him. I mean, I couldn't believe he was trying to tell me not to look it up. I'm like, this is going to be life altering, changing event for me, my kid, like, of course I'm going to look it up, you ding dong. But I mean, don't take everything that he says. If you have a doctor telling you don't look it up, don't listen to him. Like, look it up.
Absolutely. And look, some people have that sort of assertiveness in them, and they might be thwarted by, just fear and, oh, what's going to happen to my life? And then they don't. But the fact is, when you go through your life and all your experience saying, yes, I have anxiety, I have fear, but I'm going to meet this challenge. I'm going to do it. I'm going to take care of it. I'm going to look up that word. I'm going to go to another doctor. I'm going to figure this out. I want to understand. And
Yeah,
I
I
don't
agree.
really care where you are on, like I said, the health literacy level. You understand to the best of your ability, and you're going to be so surprised at how much you can absorb and how important it is for you to know. When you realize something is so important for you to know, whatever it is that you might have or at high risk for, that you want to monitor. I mean, this is if you are in a way in the state of mind where life is really important to you. Life is important and you want to really do the best you can, whatever it is. And if you might have this hobby that you work on all the time and you're so proud of it, but you ignore your health and you don't go to the doctor. You don't see, you put it off for years to see a doctor. And then you find out, you have this thing that's wrong with you, or you don't really like to talk to people about it. I think what you mentioned before about patient communities. So I want to go back to that, the communities, support communities. Patient communities are the strongest they've ever been in history. One, because of the internet. Two, there's much more specific information on disease specific categories. There's just so much online, and many of them have patient support groups, and you learn so much from other people. When I was really dreading having a stem cell transplant because online the statistics were not good, and the doctors knew I was really struggling with this decision, they gave me a name of a peer patient to talk to. And I spoke to this woman multiple times before I made my decision. And she really helped me come to terms with, which side of life do I want to be on and what's going to, just really help me. And when I realized that, when I had a plan for my stem cell transplant, it was really months of planning aside from getting medical clearances and insurance requirements and then physical requirements. And then, the whole process was 5 weeks. So I had to pack, I had to get the house in order, what it was. And I kept like really driving myself crazy to cover every last detail because I really thought I might not come out. And that was my mindset. I got to do everything because I might not come back. Until one day, I don't even know what it was. Something shifted in my mind. And I said to myself, if it doesn't get done before I go into the hospital, I will do it when I get out. And that just, my whole mindset changed. And I had this sort of newfound courage that I am going to fight and be part of this. And I want to know everything that's happening to me. And yeah, I'm going to listen to the doctors. I'm going to ask questions, and I'm going to make really the best from what I can do and my contribution to this health journey. I'm going to make it. And I have 35 years experience in the healthcare field, and was being monitored for this disease for 13 years. And I still had to convince myself, whatever shift that I made, that I have this power in me, this energy, this whatever, to make it over that line, And, may seem dramatic, but when you don't take care of your health, including, women getting mammographies or women getting pap
I'm
smears,
terrible at that.
or men getting tested, testing for prostate cancer, all these having colonoscopies, all of these things, when it's in your control to do that, to save your own life, why wouldn't you do it? And it's all part of this process that we have to like alleviate this fear. And we have to say there is a process, there is a pathway that you could follow, and the fear lessens because you have something very concrete to do. You have something very concrete to do to take care of your health.
Well, there's the end result. You got, you want to keep on living too. There's that. No, all of this is great. I kept pulling you out of your flow. So I feel sorry. Was there something more that you wanted to add?
Oh no, that was,
I'm a talker.
I hit my high note, and I haven't told that story in a very long time. So I hit my high note on that one, but I do have more to share. So the fourth part of being engaged in your care and having better communication with doctors is, I call it participation, and it is the culmination of everything we've talked about, but it's actually in the exam room. You're in the exam room with the doctor. You have your notes. You're also recording answers to the questions that you've been asking the doctors. It's important to put it down as soon as possible or right after the appointment, whatever it is. But you need to engage with the doctor. Why are you asking me that question? He asked you a question. Why are you asking me that question? Or what's that medication for? Or whatever the question is, so you can be engaged in your care. You can be engaged in the discussion about the doctor's diagnostic process. So I also talk a lot about what doctors are trained to do in terms of really, it's called the medical interview. And so the medical interview happens when you're in the exam room, when the doctor wants to understand you as a patient and then wants to like examine you and to sort of, it's called differential diagnosis, figure out what it could be. And maybe it will require other testing and everything. And then the third piece of this medical interview then is the plan, the treatment plan. What is the follow-up, but what's the treatment plan? So those are these three parts, which again has to be squeezed into this 15-minute time frame, which is so important that you, in a way, be on your game in terms of this conversation, in terms of the interaction, because you want to let the doctor know, I am listening to you, I hear you, I understand this, but I don't understand that. Can you explain this more? Where else can I look for resources? What else do I need to know? What should I be looking for when I get home? How can I contact you in between appointments when I think of other things that I want to ask you?
You know, they're also sizing you up in in your initial appointment as much as you are them. And they're trying to find out your ability to take everything all in. And if you come with your questions and, you know, you sound and you're coming across, intellectual and that you can take this, just you have to tell it to me. Because sometimes I feel like doctors, they don't give you the full scope or the full show because they're afraid that maybe you just won't get it. I mean, that's almost what that doctor was telling me, like, oh, you're going to want to look this up, but let me tell you really what it is. And, but he really wasn't telling me. He was trying to draw it on a piece of paper. Oh, here's the heart. And I'm like, that just looks like a blob. I don't even know what that is, but, I have become I have educated myself on that, obviously, and I believe that those, groups, the groups that you can find online did help because, I knew that they said she would need a surgery throughout her whole life. But I found people that were old, 60 years old, having their fourth surgery. And it really brought it home like, oh my God, she is going to have surgeries all through her life. Oh my God. Like, it just hit me in a different way. It wasn't until I saw it in someone else experience it that I realized that was what's going to be her life. And so those are very important. And like you said, you only get those 15 minutes in that doctor's appointment. You need to make sure that you are fully prepared. You ask all the right questions. And then, what you need to ask at the end? Is there something that I didn't ask that I should know, At the very end, let him round it up and summarize the whole thing. You know what I mean? And I think it's important to, like you said, where can I, do you have any resources? Where can I go next? Where can I call you if I need you? And put him on the spot and, make him say, yeah, call me,
Right. And there's a lot of different methods now with patient portals. Some of them like to get emails through the patient portal. Some of them, my hematologist gave me her cell phone number. I text her when I need her. And I said, I don't want to bother you. She says, no bother. You text me whenever you want to text me. And other doctors, it's just call my office. Other doctors give you their direct email. So that's why it's so important to ask the doctor that question at the end. Okay, how can I contact? How do you like to be contacted? What's the best way to reach you that's most efficient?
Those patient portals, I used to say no. I'm like, no, I don't need it. I'm fine. I don't need it. And now I'm finding that I love my chart for my daughter. I'm like, oh my God, I can email him or her. She's got like 50 million doctors and and now they're working together because they all can see this in this chart. And I had her new cardiologist through Loma Linda. They're great in California. And she just is setting me up with all these different other doctors. She's like, no, Jessica, she needs to be checked for this. And she found me the geneticist. Piper was born in 2010 and she passed her genetic testing with flying colors. But now 2025, it's crazy. The technology has changed. And yes, it's now has changed. And now I found out something that I should have known my whole life. Piper was very quirky and cute and sweet. And, we always blew it off like, oh, she'll grow out of this stage, and now she's 15 and she's not growing out of it. And I'm like, this is not right. And her doctor saw it. She spent 45 minutes with us in the appointment and she spent a lot of time with us, and she wanted to get to see and know Piper. And she said, no, Jessica, she needs to get her genetic tested again. And so we did, and we found out. So now it's a whole new world for us. Just a couple months ago, we're just now diving into it. But that's what sparked me wanting to start the conversation that we're talking about today, advocating for yourself. Like they say in the airplane, you got to put your mask on first before you put on your kid's mask. Well, you got to take care of yourself. And then, you got to advocate for your kids' welfare when it comes to their doctors and their well-being. And, all the information you're giving me, it just really reminds me that, what I think I know, sometimes I don't really know everything, you know what I mean? And sometimes it's good to hear from somebody else that's gone through it. Like, these are the things you need to do. Write it down, take note, research beforehand. Definitely, know what you're going in there for. And also sometimes when you see a primary doctor for the first time, make a list of everything that's not right, make a whole list. It's, my toe hurts, you know what I mean? Might get ingrown toenails. I don't know, whatever. I'll make a list of all the things and make him help you get through. That's what you're there for, to see him, to fix you. That's their job, right?
Absolutely. And I think that the more the doctor sees you so willing to take care of yourself and do what it needs to be done, believe it or not, it's more fulfilling and satisfying for a physician realizing that they really love to work with people who want to take care of themselves. I have really found that. Other people have told me that as well. So, it's not an adversarial thing. Sometimes when you say, advocacy, it's not about adversarial. It's about working together and letting your doctor, get to know you. I mean, as I said, you can't really force doctors to say, oh, how come you're not more compassionate and empathetic? And why aren't you asking me more questions? And
Yeah.
I don't think you like me too much, whatever it is. It's really not about that. You have to be you. You have to be you, but you have to be prepared. You have to share who you are. It's not easy for a lot of people. People don't want to talk about some of the really sensitive topics, that how much they drink, or if they smoke, or if they do drugs, or, sexual activities or risky activities, whatever it is that people do. These are things that they withhold from the doctor, but it really could affect how the doctor is diagnosing you and what they're looking for. I mean, even if say you drink 20 Diet Pepsis a day, the doctor should know that this is not good for your health. So it
Right.
might seem oh, these are my lifestyle choices. Your lifestyle choices that you ingest, right, or expose yourself to really can have a big impact on your health. And a lot of people don't realize that.
I just really appreciate you coming on today. And did we hit all the points? Did I miss something? Did
Well,
I leave something on the table?
I usually just end with that it's really important to develop as much sort of courage as you can. I consider that as part of the equation. And courage doesn't always come easily. And you can be really courageous in one aspect of your life, like you could like to skydive, but you don't like seeing doctors, right? So it's about courage related to taking care of your health and being engaged in your care. And every little thing that you do keeps adding up and adding up until you develop that courage and not being afraid and wanting really to take care of yourself. So that's how I usually, wrap up the package of all the tools and skills that could be at your disposal to interact better with doctors to take care of yourself.
Well, I appreciate your knowledge and letting us pick your brain. And can my listeners go somewhere to find you? Would you mind sharing?
Sure. So there are two ways. One is I'm very active on LinkedIn because I post regularly on health related communication subjects. And you can contact me on LinkedIn, Dana Sherwin, or you can go to my website at thethinkingpatient.com, where that's the consulting business that I run. And there's a, contact form there as well.
Well, I appreciate you coming. I appreciate you, giving us your time, and I appreciate you very greatly. And that's going to do it for tonight. Thank you so much. I appreciate you.
Thank you.
All right. Bye-bye.